Well, liposuction is a wonderful thing. Who doesn't want to have their waist a little skinnier, or the fat on the abdomen or the belly is a little less, and whether it is like 5 pounds or 10 pounds or 50 pounds, who doesn't want to have this? This is a wonderful thing. Liposuction can be also an enhancement to an image. So instead of actually having 50 pounds to lose, you probably only have like 10 pounds to lose. It would make you have a wonderful demeanor. It will give you a drive to kind of like lose more weight after that. You will look wonderful just in a couple of days. Who doesn't want to do that? It's a wonderful thing. Liposuction can be done by general anesthesia and can be done also by local anesthesia. What we like to do is the local anesthesia, or what we call it the tumescent anesthesia. Local anesthesia is really a good way to go. The patient is very comfortable. The level of the pain, we usually give a level of pain from 0 to 10. We ask the patient, okay, how much pain you have? And usually the patient will say between 0, 1, maybe 2. So very, very comfortable for the patient. Sometimes they actually have phone calls during the procedure, and they laugh and they crack a joke, so their level of comfortable is wonderful. And then also at the same time there is a dialogue going on between the doctor, the surgeon, and between the patient. So she will tell him, oh, remember I told you this side needs more doctor rather than that side. One of the exciting things also that your own fat has got your own DNA, so you can always take it and put it somewhere else. What does this mean? It means a good solution for people who want their breast to be bigger, more enhancement of the breast. So this is something that we can do without any surgery, and believe it or not, a lot of people are really attracted to this. There is a lot more use to fat harvesting and fat transfer, which means that the fat that you can take from one part of the body doesn't have to be thrown away. We can always use it to amplify, to augment, to sculpture, to make other parts of your body much more beautiful. So this is something that we like to do. The fat harvesting is coming back to the market and to the industry and to the medicine again. So a lot of people are interested in this because it's cheaper to have your own fat rather than to have general surgery or augmentation with artificial fillers. So this is exciting. The liposuction, when it is by tumescent or by local anesthesia, makes a lot more sense, because I can sit up somebody and I can look at that person and say, well, I don't think you're done yet. However, if you're lying down completely and you're numb under general anesthesia, you're not able to talk to the doctor. He really cannot sit you up and look at you and then put you back to sleep. So there is a lot of advantage about the local anesthesia. Local anesthesia, your recovery is 24 to 48 hours. You're home the same day, you're comfortable, you're talking to your surgeon all the time, you have your friend, talking to you all the time, you're cracking joke, you're listening to music. So it's a relaxing, nice atmosphere, and what a wonderful place and a way to have the fat, taken out of you. So for somebody who wants to have their waist a little skinnier, or the breast a little bigger, or the belly a little smaller, or the hips a little smaller, this is a wonderful thing to do. Liposuction had a lot of technology coming out to it. So on the horizon, I'm sure there will be some more technology, but for now, we have 4 major technology going on. You can do liposuction by itself. Liposuction by itself is just sucking the fat out. It's just very simple, taking the fat out by something that looks like a crochet needle, or what we call a cannula. So just imagine that you're actually vacuuming something out of a place which is sucking out the fat. That is simple liposuction. There's something else called PAL or PAL. It's a power-assisted liposuction, and that's another technology that we have, and the energy behind it is electricity. So the power that we use to actually drive more fat out of the body is assisted or helped in a way by the technology, and that technology is run mostly by electricity. So there are gadget, apparatus, a whole pendulum of technology, but the bottom line is that the technology helps the fat to come out of the body easier, faster, smoother, and more important, in a live way. So if we don't destroy the fat, this is the most wonderful way to try to use the fat for other parts of the body, so we don't destroy the fat. Another technology that is out there is called the Vaser liposuction. Vaser technology is mostly run by ultrasound. So we use that technology of the ultrasound to melt the fat, or in our lingo we call it emulsify the fat. So that ultrasound technology actually goes in, and it's also another apparatus that we use, and we have this technology here and we use it, and has been in the foremost, most successful technology that we have in the liposuction. One of the brightest three technology that is on the market is the Vaser liposuction, and that is very simple. After the local anesthesia is given, we go with the technology of the Vaser. The fat is emulsified or liquefied or melted, and then we go in and aspirate it, and the net result, just a tiny little band-aid that you have on the belly or on the skin. So there is hardly any scar that you can see, but obviously there is a tiny little hole where we actually have our so-and-so needle or a little probe that will suck the fat out.